Welcome back to Medical Monday. I'm here with Dr. Susan Bradley talking about colon cancer awareness and colon cancers and rectal cancers. If you have a question, go ahead and give us a call. We have a few callers lined up. Let's first talk to Linda on the line. Linda, thank you for your patience. What's your question tonight? Linda, are you with us?
Yes.
Okay, good. Go ahead.
If you have a pylori virus, should you have a colonoscopy?
Now, H. pylori is associated with ulcer disease in the stomach and the upper portion of the small intestine. And as far as I know, there's no relationship between H. pylori and colon cancer.
So then you would just follow the normal recommendation, right?
Right, screening at age 50 if you're at otherwise average risk.
Okay, Linda, thank you for calling in with your question. Let's hop on to Seymour. Seymour, what's your question tonight?
Hello, can you hear me?
Sure can. Go ahead.
Yeah, Seymour Butt here. I've had 3 colonoscopies before, and I was wondering what kind of screenings I would need to go through if I was passing blood in my stool. Nothing's really showed up before on my colonoscopies.
So when was your most recent colonoscopy?
Believe November. It was October, November 1.
Okay. Well, that would not come under the definition of screening. That would come under diagnosis. So if you're having persistent rectal bleeding and you had a colonoscopy and it was normal, then you need to go back to the doctor who did the colonoscopy and say, I understand the colonoscopy was normal, but I'm still having bleeding. Let's try and find the cause.
Okay, very good.
You can't just let it go, but
because that's not normal.
Yeah.
Right. Okay. Let's hop over to Kim. Kim's on the line. Thank you for being part of the show. Kim, what's your question tonight?
Yes, I have had quite a bit of rectal bleeding all my life, and I've had 3 different colonoscopies, and nothing ever become of them. The last one was about 3 or 4 years ago, and I was just wondering what causes so much rectal bleeding?
There are a number of things that can cause rectal bleeding other than rectal cancer, and it's good that you've had your colonoscopies to make sure that there's no colorectal cancer there. That being said, with this caller and the previous caller, things can be missed. So that's why you need to go back to the person who did the colonoscopy or your primary care physician and say, I understand it was normal, but I'm still having bleeding. It's still not explained.
Because it is not normal to have rectal bleeding.
Right. However, hemorrhoids are pretty common, and although, I don't want people to ignore their rectal bleeding, say it was probably hemorrhoids, that might be the case with these 2 gentlemen. They could have hemorrhoids, and they may need to see a colorectal surgeon about the bleeding to say, hey, I had my colonoscopy, here's the report, I'm still having rectal bleeding, can you help me figure out what it is?
When that happens and someone walks into your office, what are the next 2 or 3 steps you take?
We talk about their bowel habits, their diet. Of course, I want to get a copy of that colonoscopy to make sure that they, in fact, did a good job, that there was nothing obscured by a poor bowel prep. We do a general medical history. I find out about are there any other of those symptoms that are occurring, abdominal pain, change in bowel habits, weight loss, or is it just the rectal bleeding? Is there any rectal pain? Then, of course, we look at the other medicines they're on. So many people are on aspirin now to prevent strokes. People who are on, who have atrial fibrillation are on blood thinners. So we go through that. Then I do an exam. And I look at the bottom. I do an exam with my finger. And I have a little scope that I can put in that's very good at detecting hemorrhoids. And if I feel that the hemorrhoids are the cause of the bleeding, then we start treatment of the hemorrhoids. And that could be something as simple as psyllium fiber, rubber band ligation, surgery.
Okay, easy enough. Okay, that's a great question, Ken. Thank you for calling in. I do have actually, we'll go to Nancy real quick. We have Nancy on the phone. Nancy, are you with us?
Yes, I am.
Hi there. Go ahead with your question.
Okay, 10 years ago, I had 5 polyps removed. Okay, but since then, 5 years ago, I had another colon test. I was fine, no polyps. Now, when should I have another colon test?
That's controversial. I was hoping that wouldn't come up because that's
You
a
knew it
tough
would,
one.
though. Yeah.
Yes. Personally, I would say 5 years
Okay.
that you should repeat it. Some insurance companies disagree with that. But let's say that your insurance company comes down on the 10-year side. Then in the intervening years, I would have your primary care physician check your stool for blood. There's the little fecal occult blood cards that are very old-fashioned, and they actually pick up too much stuff. They're overly sensitive, but having had 5 polyps at one time, I think you should have that test every year, and if it's positive, then your insurance will pay for a colonoscopy, and then you can make sure. But if it's negative, I think you can feel pretty good, but make sure that you do get that colonoscopy at 10 years.
Thank you.
Linda, thank you for
welcome.
being part of, Nancy, thank you for being part of the show. I want to take a moment as we get other callers lined up. We do have some phone lines open, just if you want to give us a call, do it now. You know, we've been talking about colon cancer, rectal cancer, and usually that is in an older generation.
Yes.
But there is a trend that has just developed or just been noticed that's very alarming, and it deals with 20 and 30-year-olds. Tell me about this.
We've noticed it for several years, but just this year there have been some stories in the media documenting the fact that people born after 1990 have a much increased risk of developing colorectal cancer, and it would be at a younger age as well. And a lot of this is rectal cancer rather than colon cancer. We don't know why. Is it from the diet, too much fat, not enough vegetables, exercise, obesity, smoking? Those are all things that are associated with colorectal cancer. But the numbers are still small, and we just really don't know. Even the articles that we read cannot pinpoint what that is from. The youngest patient I've taken care of was 26, but was a heavy smoker. I have another 32-year-old who's fit, thin, vegetarian, non-smoker, who developed rectal cancer. So we just don't know. But the take-home message is that even if you are young, if you have any of the symptoms that we've been talking about, rectal bleeding, anal or rectal pain, abdominal pain, change in bowel habits, weight loss, anemia, you got to get checked. And you know, one of the articles that I recommended to you had a case of a young woman who, you know, the doctors just kept putting her off until she had stage 4 metastatic disease.
Which means it's spread.
Yes.
And she's okay now, but...
Yeah, she's not cured.
No, I mean, she's a 22-year-old, and she's gone through this, and she's got a long life ahead of her, we would hope.
And, you know, I can't scope every single person I see that has one little drop of blood.
Right.
And that gets really difficult because everybody's seen a little bit of blood on the toilet paper. But if it's ongoing and, you know, it just doesn't feel right, at least get a rectal exam. But again, you know, I may not scope every single person.
But keep,
But
so
boy,
you got to
if
be your
they keep-
advocate.
You know, they keep coming back and they have further symptoms, then we're going to scope them.
Let's talk about the other risk factors. We've talked about some, but let's kind of hit them down the line. So if someone's just tuning in, the risk factors for colorectal cancer, what should people be watching out for?
Well, the risk factors that may predispose to the development of it are family history, a high fat, high red meat, grilled meat diet, low in vegetables, low in fiber, cigarette smoking, maybe heavy alcohol use. And those are risk factors. But, you know, not every smoker gets colorectal cancer.
No.
Some of them get lung cancer. But those are the things that if you want to improve your overall health, quit smoking, lose weight, exercise, and eat a more plant-based diet.
And that should help you out in a whole host of different
That's
things.
good for breast cancer,
Yes.
heart disease, diabetes.
It seems like every doctor we
Everything.
have on Medical Monday says the exact same
Yeah.
thing. So you're not going to go wrong by doing those
Right.
things. What about when it comes to gender? Are men more predisposed to this? Women? Does it matter?
No,
No, not at all.
it's an equal opportunity killer.
Gotcha. But again, we should take home the message that screening works, and this is very curable if caught early.
Yes.
What happens when it's not?
When we diagnose a colon cancer, we do biopsies during the colonoscopy. And if we get that, when we get that result back, a lot of it depends on which anatomic location it is in the colon.
Okay.
The next step is usually some blood work and a CT scan, and that has multiple purposes, but really to look at the liver, because colorectal cancer tends to spread to the lymph nodes and then to the liver. So we like to look at the liver, and then we get a chest x-ray. If it's a small colon cancer that does not appear to have spread, then we schedule the patient for surgery, and we remove that section of the colon. And some people think, well, can't you just go in and scoop the cancer out? No.
Yeah.
You take out that section of the colon with the lymph nodes that serve that part of the colon.
Okay.
Then we send that to the lab, and then they look at it and they tell us if the lymph nodes are involved. If the lymph nodes are involved, then we may recommend chemotherapy. Now that's for colon cancer. If it's rectal cancer, that's a whole nother topic. We do MRIs, we do ultrasounds. Depending on the stage of the cancer, the patient may need preoperative chemotherapy, radiation, then surgery, then more chemotherapy. So
Highly involved treatment.
Yes.
Highly involved. Okay, we're going to talk a little bit about more when we come back. Of course, taking your phone calls as well. The lines are open. 615-737+ is the number to call. We're coming right back. Stay with us.